My name is Dr. Rusty Moore, and I'm the Medical Director of the Acute Rehabilitation Unit here at Dixie Regional Medical Center. Some of the differences between an acute rehabilitation unit and other rehabilitation options in the community are that you can be seen by a physician every day, that we have nursing ratios that are similar to what you see in the acute hospital, and that we're able to provide 3 hours of physical, occupational, and or speech therapy to our patients on a daily basis. In order to come to our unit, basically you need to have had an illness or injury that makes it so that you're having difficulty taking care of yourself. You have to be able to tolerate a fairly intense rehabilitation program, and you have to have the potential to significantly improve. Some of the patient populations that we routinely serve are people who have had strokes, people who have had spinal cord injuries, people who have had an injury to their brain, or patients who've had surgery such as cardiovascular or orthopedic surgery.
What we feel makes us unique is how we teach people to move. What their postural alignment is, what their body mechanics looks like when they're doing any kind of function, and really training the core part of their body to learn how to coordinate better and produce more efficient movement. It's pretty intensive in the sense that it takes a lot of physical guiding, a lot of physical work from the therapist. It's very hands-on. We spend a lot of time with movement experience, lots of rolling, changes of position on the mat, coming from your tummy up to a sitting position, learning how to get on the floor and off the floor. So it really more simulates reality of what they're going to be needing to do at home.
I know that probably some people feel uncomfortable having to do 3 hours of therapy, but they should never be concerned with this particular rehab because they do work with you one-on-one, and they only ask you to try to give your best, because believe me, they are giving 110% to make you functional, stronger, and able to go home to do what you did before, and in some cases to do better than you did before.
Nurses are there for you 24/7 to care for all of your needs. They're there to take care of your pain and to help you feel better and able to participate in therapy. I'm really happy to say that nearly half of the nurses on this unit have received a special certification in rehabilitation nursing. What this means for you is that they are uniquely qualified to care for your rehabilitation needs. One thing that you'll find unique on our unit is that therapists and nurses work very closely together to provide you the best care possible. A therapist will instruct our nursing staff on how to best help you walk, how to best help you get in and out of bed, and help you with your showers and other personal needs. A therapist will train a nurse adequately so that the nurse can carry on with those activities even after your therapist has gone home for the day. That means that even though you're not with your therapist, you're still working on those things that you will need to help you get back to life and back to your regular routines.
One of the things that we pride ourselves on here at the Acute Rehabilitation Unit is providing our patients and their families with the education that they need in order to make a safe transition home after their stay with us. This begins by giving you information about the disease process or the injury that you've had. It also continues with giving you experience in caring for yourself while you're here on the unit. But as our patients progress and as we see that they're ready to start transitioning to home and to the real world, we try to provide them with realistic experiences outside of the acute rehabilitation unit. This might result in us taking a patient to the store for a shopping trip, or taking them outside to walk on a real sidewalk on different surfaces such as grass, sand, or gravel, and then walking up and down staircases that are more like what they're going to encounter when they're outside of the hospital. And in fact, it's routine for us to visit the homes of our patients with one of our therapists prior to them going home to help them practice the activities they've been learning and the skills they've been acquiring in their own environment. We feel like this gives the patient and their family a real idea of what needs to happen before the patient can make that important transition. It also helps them to feel much more comfortable and confident as they make the transition home.
Nurses on our unit specifically love to educate. That's one of their favorite things to do. They're going to help you and your family be prepared to take care of the needs once you go home. Part of their education is explaining your diagnosis, explaining your medications, explaining things that you need to do once you leave our unit. We want to make sure that your transition to home is successful. Within a few days after your discharge, a nurse will be calling you to ask you how things went with your transition. In this phone conversation, you can ask about your medications, about any specific concerns you may have regarding your return to home. Our nurses are more than willing and happy to help you in any way we can to help you have a good transition back to home.
I think the most help he's had was from the rehab. I mean, we couldn't have done it without him. I contribute everything to those therapists that worked with him there. It was amazing the things they did together, and every day there was something new, and the way they worked together, and James clicked with them.
It's a totally different type of therapy completely. It's not at all what people think of as therapy. Very effective, and good results, and you can measure them daily. You can actually see the difference daily.
I can't say enough about each and every staff member of this unit. It is absolutely beyond anything that you will find in any other facility that I'm aware of. So,
the greatest part of what I do is seeing a patient who came in unable to move, unable to dress themselves, even having difficulty feeding themselves, and watch as they progress and learn new skills and see that when they leave, they have a plan. They understand what they need to do. They feel comfortable that they can make it in their home environment. And nothing makes us more satisfied than when we see a patient come back to the unit after they've transitioned home to show us that now they're walking, now they're caring for themselves, and now they're living on their own. That's success. That's what makes what we do so important. And that's why we're so committed to helping each individual get back to life.